Okay, hello everyone. Welcome to the Storytelling and Public Policy session of our 2022 Medicaid Summit. Those of you who have been on the previous sessions this morning, thank you for spending your day with us. And thank you again to our amazing staff here at West Virginians for Affordable Healthcare, most especially Miss Brittany Rule, who is an absolute rock star behind the scenes today, coordinating all of this. She's been really, really wonderful in getting all of our speakers together. And so we thank her for her time and her energy and all that she does for our organization. So without further ado, I'm going to share my screen and we'll get started here. Okay, let me just make sure I'm in the right place. Okay, so again, my name is Mariah Plant. I am the story collection coordinator for West Virginians for Affordable Healthcare. And a little bit about our organization. We are a statewide nonprofit, completely staffed by wonderful West Virginia women. And our mission and our goal is to bring a consumer voice to healthcare policy in West Virginia. As many of you know, I think we have a part-time legislature here in our state, which means that they only convene for a couple months a year, which basically works out to the fact that most of our legislators and the people in power and the people making these critical decisions for us and our families will likely never experience some of the issues of poverty, food insecurity, healthcare insecurity that people all across the state of West Virginia are experiencing every day. And so it's really important that we bring those experiences and those voices to the conversation and to the table when these policies are being made. Otherwise, they won't know that we're here. So today you're going to hear from two fabulous advocates who I've had the pleasure of working with several times before, Mindy Salango and Joanna Vance. But before we get to them, I'm going to share a little bit with you about storytelling for policy advocacy, why we do it, how we do it, and some of the strategies that we implore to try to go about it in as ethical and equitable a way as possible. I'm going to advance my slides here. So again, the key points that we're going to cover today are why we tell stories, how we use them, the different methods of disseminating that information and sharing those voices with lawmakers and with the public, and our best practices for doing so. And my favorite part of this whole spiel that I like to do is really the science of storytelling. And one thing that you I think are probably already aware of, but I'd like to clock for you is that stories are at the root, at the core of all of us, at the core of our culture, at the core of how we walk through the world as just a sum of all of our experiences. And that's going to impact how we interact with others and how we empathize with the world around us. So this is your brain on data, as I like to say. This is what happens in an MRI scan when you're listening to somebody recite a grocery list or directions to a soccer field or a recipe for chocolate chip cookies. This is just basic language processing and comprehension. This is the parts of your brain, Broca's area and Wernicke's area, that are just going to intake that information at its base level. However, when you connect that data, that information to a story, you'll see that your brain lights up in all kinds of different ways. Your sensory motor cortexes are engaged, your visual cortex, your language and auditory olfactory processing cortexes light up as well. And you're engaging all parts of your mind in order to synthesize the information that's being given to you and also relate it to your own experience. We've got some pretty exciting chemicals that get released in the brain as well when you're listening to a compelling narrative. You've got oxytocin, which stimulates empathy and generosity and builds connection and kinship between you and the storyteller, even if that person is a stranger to you. You'll notice if you're listening to a particularly compelling narrative, whether that be a movie or a commercial or a play, your palms might start to sweat at a particularly exciting or suspenseful point. You might find yourself laughing or crying, and that's all because your mind is releasing these chemicals, oxytocin and dopamine as well, which stimulates your attention, focus, motivation, memory, synthesis, and learning. So not only are you just taking in that information, your brain is starting to fire off those neurons that connects it to information that you already have there. And you begin to make your own conclusions. That's the process of neural coupling, which is coherence of thought between listener and storyteller. You'll find if you look at brain scans of somebody who's listening to a story, you'll notice that it starts to look, as the story progresses, remarkably similar to the brain scans of that of the person speaking. Your mind will actually start to co-regulate and share the same neuron patterns as the person you're listening to it. So it actually really biologically creates a connection between you and the person that you're listening to. And so it's not hard to see why this tool can be so important and so impactful for us in policy making, because we want our lawmakers and the public to start to understand and feel kinship and feel a connection to people whose experiences they may not share, but are responsible for governing. So we want to make sure that we're getting those stories to them in a way that really lights up their minds and lights up their hearts as well, and gets them to take action on the issues that we care about, which of course for us at West Virginians for Affordable Healthcare is expanding the Medicaid program and advocating for a Medicaid buy-in program, especially, that will make these services more accessible and more affordable for all West Virginians. So why do we tell stories? It's to light up the brain. It's to grab attention and stimulate empathy between strangers, to depoliticize sensitive issue areas that people come into the conversation with their own baggage surrounding. We find that when you confront somebody or you face them with a real human face and a real human experience, you start to break down a lot of that stigma and preconceived notions that a lot of people may or may not have about certain experiences and especially public assistance programs, which again, many of our lawmakers will never need to utilize in order to put food on the table for their families or to get their kids to the doctor, because they live in a state of privilege that means they simply will never have to utilize those services. It also makes data memorable when you connect that information to a human face. It's easy to say and put in a little infographic that 1/3 of West Virginians are on Medicaid, but when you meet people on Medicaid, when you meet their families, when you hear their stories, that 1/3 percentage really becomes a lot more impactful, I think. And it also, of course, inspires action. It puts that human face to an abstract issue, and it leaves people with a feeling of being responsible to do something, to take action, to help somebody, because that's who we are at our core. We're all empathetic, kind human beings, and sometimes we just have to get our attention called to a particular issue area in order to inspire change. The fourth reason we tell stories, and for me, the most important reason that I do this work, is to engage and empower communities in need, people who aren't often at the Capitol lobbying and advocating for policies that impact them, quite simply because they're at work. They're picking their kids up from soccer practice. They're trying to take care of their business, and it's our job to make sure that we're advocating not just for our own interests, but for the interests of our greater West Virginia community. So we want to amplify those voices of low-income people and help bridge the gap between them, their communities, and most especially policymakers. It's also a massive value added, not just so that we have stories to share for our policy concerns, but so that we start to include people and we pull a seat up to the table so that they can advocate on their own behalf. I'll advance to my next slide here. How do we use stories? The way that we like to talk about it is by qualifying, not quantifying data. So again, bringing that human face and showing the people behind the issues that we're trying to talk about. One of the projects that we're engaged with the West Virginia Center on Budget and Policy is the Emmy project, or the Elevating the Medicaid Enrollment Experience, which is specifically geared toward listening to the experience of people of color and Black West Virginians who are enrolling in Medicaid, and we want to see how we can make that process of enrollment more accessible, more welcoming, and an easier place for people to get the help and the resources that they need. So if you are interested in taking a survey or sharing your experience with specifically the Medicaid enrollment process, perhaps how your experience was positive, negative, how it could have been more accessible, made easier for you, I'd love to hear about that experience. If you want to give me a call or give me an email at the end of this session, my information will be on the final slide. We also do a lot of educational media and content creation around blogs, op-eds, letters to the editor of the newspaper. We do social media outreach. You'll see a couple of little blurbs here from storytellers, video, audio, and photo content to, again, just share the real human faces and the stories of West Virginians to places and areas where those issues might not be so widely experienced or widely understood. And of course, the third way that we use stories is through public speaking and citizen lobbying, putting the people experiencing healthcare insecurity right there at the face of the lawmakers. You'll see our storyteller, Mindy Salango, there, and the other photo is, I believe, from the 9/11 Victims Compensation, Hero Compensation Fund, which they must renew every single year by going in front of Congress and lobbying for that money to take care of our first responders. And my last section that I'll talk about before I throw it over to our fabulous storytellers is story collection best practices. Again, we want to be as ethical, equitable, and inclusive as we can with storytelling, so that we're not just extracting people's experiences and using them for our own agendas, but we're calling people in to the cause as well and elevating them up that ladder of advocacy. So what do I mean when I say ethical, equitable story collection? I mean that it is transparent. We are constantly in contact with storytellers, giving them informed and renewed opportunities to consent to sharing their story, consenting to the method in which their story is shared. Some people are comfortable sharing their experience for the cause, but they don't necessarily want their name or their photograph or a video of them attached. That is totally okay. We want to make sure that our storytellers are empowered and they feel good about any and all content that we're putting out associated with them. So I am constantly at every step of the way making sure to send back drafts and of people's stories and anything that we're going to send out with their name on it, so that they can give the green light and they feel included as well. That's also a part of being collaborative and not just rewriting somebody's story or somebody's experience to be a good, nice little soundbite, or to fit into a 30-second advertisement, but to make sure that we're showing people as holistic, real, well-rounded human beings, not just their healthcare struggle or not just their financial struggle, but who they are and how their experience doesn't exist in a vacuum. We often see that people who are experiencing healthcare insecurity also have issues accessing clean water, often have issues accessing food. There may be overlapping issues with substance use disorder. So nobody's experience exists in a vacuum or exists solely from the perspective of one issue area. Everybody is a well-rounded individual, and we try to communicate that through our storytelling efforts as well. And it's also mutually beneficial. Ethical storytelling is, we want to make sure that we're giving people opportunities to access their lawmakers and access opportunities to tell their own story. And we also want to compensate them as much and whenever is possible, so that it's not just us as paid advocates who are getting paid to share these stories and to advocate for our neighbors, but it's also the people who are going the extra mile to expose themselves and share what can often be a vulnerable part of their experience with the greater world. And so we want to make sure that that's reflected in monetary compensation whenever possible. And that can be done through gift cards, through gas cards, through straight up cold hard cash if we can. So we want to make sure that we're recognizing people's value added with monetary compensation whenever possible. And so without further ado, that's sort of the condensed version of my job and what I do as a storyteller and how I try to go about that in as kind and as ethical and transparent a way as possible. But the real star of the show today is our storytellers themselves. And so they're going to explain to you how they came into advocacy through their own experiences. They'll share a little bit about their story, and then they'll share what I'm most excited to hear about from both of you ladies is how elevating from being a storyteller with lived experience to an advocate to, in the case of Miss Joanna Vance, a candidate now for the House of Delegates in West Virginia, and how being a storyteller and being a person with lived experience really offers them a unique perspective and a unique alleyway into policymaking, and why it's so important to include folks with lived experiences in the policy conversations and in the lawmaking process here in West Virginia. So first, I'll introduce Miss Mindy Salango, who is a Morgantown-based organizer and advocate. She is a volunteer chapter leader of T1 International Insulin for All campaign, and she is a lifelong diabetic. She's also near and dear to my heart as a theater maker herself, and she's a great storyteller. And I will allow her to take over from here and share with you her experience as a storyteller and as a person living with diabetes in West Virginia. Mindy, take it away.
Hi, thanks so much for having me. Mariah actually started my career as a advocate, so I'm very grateful to her. I'm sorry if I'm a little jumpy. I have a puppy and he is kind of excited about this whole situation, so he wants to see what's happening. So but I started a couple of years ago advocating for lower cost prescription drugs, particularly insulin, as a type 1 diabetic. I am a type 1 diabetic, have been for about 28 years now. And I did have to go through a period of rationing my insulin right after my divorce in order to survive. So I know what it's like to be in that situation, because insulin prices have gone up almost 1,500% over the last 10 years. So it's very difficult, particularly if you don't have insurance to afford being able to keep your life-saving medication. So, and my situation is I was insured, and a lot of people do not understand. And that's what I have found by coming out and telling my story so much, is that people don't really understand how all this works. They think if you have insurance, then you're covered and everything's okay and you don't have anything to worry about. When the reality is that it doesn't save you. Insurance helps, definitely. I'm not in the position that a lot of other diabetics are in, but where they don't have insurance and are struggling to pay upwards of $1,200 a month for their insulin out of pocket. Mine at one time was as much as my mortgage, which was $500 a month. I'm going to try to turn my camera around here. I don't know if that's going to work with the way we're set up, but I'll turn it around here. Just excuse my messy house if you see it. This is what I use in a month in terms of my diabetes. We've got insulin, backup insulin, glucose control devices, a CGM, which is a continuous glucose monitor, needles for the pens, my pump supplies. So you can see there's a lot more than just a vial of insulin. This particular vial of insulin will last me about a week and a half. And this one vial of insulin is $300 per month without insurance. I'm very fortunate now to have really good insurance. At the time when I had to ration, I did not have good insurance. Without this medication, I can go perhaps 24 to 48 hours without dying. But I have gone a week And I can tell you that it was probably the most horrific week of my life. And so it is really important that diabetics have safe, affordable access to their medication. And so that's what I've been fighting for. As I said, Mariah was my start into the field. And since then, I've kind of gone and I have spoken with Nancy Pelosi, Speaker Pelosi, and the chair of the House Committee on Ethics. And and then I was also invited to to President Biden's first State of the Union address as a diabetes advocate. So I've been able to make a lot of inroads. The reason I find that it's important to speak out, and not everybody's like me. I'm an open book and I'm kind of loud, but I think it's important. So as Mariah has stated, they know we're not alone. Others know they're not alone, and they feel safe to speak out. And also it's about education. A friend of mine has a motto she goes by about things. She says, "Don't hate, educate." So I try not to get frustrated when people conflate type 1 diabetes and type 2 diabetes, because they are very different diseases with similar issues, but they are very different. But so I try to educate, and I have found that a lot of lawmakers don't even understand the difference or the struggles that we're going through. So I feel I'm an asset in the education process of our community and of our lawmakers. Have we gotten everything we wanted to get? I mean, fortunately, we were able to get lower cost prescription insulin for Medicaid. But the fight for me doesn't stop, because there's still, there's still the rest of us who are either insured, underinsured, or completely not insured, who still struggle to afford their medications every day. So for me, this fight continues until we can get the drug makers to lower their list cost. And that's the end goal for me. So that is why I have taken the volunteer position with T1 International and their Insulin for All campaign. And I'm really excited about that. And I'm just hope to, keep going. And I'm excited that our other speaker is running for House of Delegates, because I think that will be a great asset, because we will have someone who with a lived experience there. And I think that's just so important. I've always said, if you can get me in front of somebody, I can talk to them and I can at least make them understand. So that's where I'm coming from as a storyteller. And I hope this was helpful a little bit. And if you have any questions for me, I'm definitely happy to help however I can.
We are crazy blessed to have Mindy as one of our rock star storytellers, and she brings up a lot of good points about how important it is to just get in front of our lawmakers. I think we can often feel, especially here in West Virginia, that there's a separation between us and them, or that they're inaccessible, or that we can't go and speak to the people who make decisions on behalf of us and our families. And you just heard from Mindy, who's gone not only statewide, but to national events on behalf of the Insulin for All issue and on behalf of diabetics. And I wonder, Mindy, before I let you rest here for a second, if you could just speak to what it's like getting over that hump of that separation, or that us and them feeling, what it's like to actually get in front of lawmakers and have that feeling of intimidation maybe decreased or lessened, realizing that lawmakers are people too. And once we present the information to them and we present it in a way that they can access and understand, which is, like you said, the human perspective of meeting a real human person and not an insurance advocate or an insurance spokesperson. If you could just speak a little bit to that and what it's like to go and talk to your lawmakers. So hopefully people listening today will feel like it's not so daunting of a task that they could do themselves.
Oh, absolutely. And I think one important thing to realize is that, at least in DC, I mean, like you said earlier, we're people living and taking care of our families and working. We can't be in Washington, D.C. or at our state capitol every single day. But in D.C., for every lawmaker there, every member of Congress, there are at least 2 pharmaceutical lobbyists there every single day for every person. So there's double the amount of our lawmakers in pharma lobbyists. So we're really fighting an uphill battle. So for them to hear from us is vital. And because it's constantly in their ear, with, taking them out to dinner, taking, campaign donations, things we can't do. So, but getting over the us and them, it's just, they're people too. They may try to put on an air of betterness, but they're people too. And I promise you, at least in the healthcare portion of this, if they're not struggling with it, which we know they're not, they know somebody who is. And, you just kind of have to give it, a personal feel, and say, look, you have to know somebody, your neighbor, somebody down the street, somebody is struggling with what I am. And this shouldn't be happening. And, they put their pants on the same way we do every day. So they're people. And it is easy to be intimidated. And I just got over it quick. I'm not afraid. I guess I'm just not afraid of them. And, they can't take away your birthday.
They cannot take away your birthday, Mindy. You are absolutely correct. And thank you again, just so much for taking the time out of your day and for dedicating so much of your mind, your heart, your time, your spirit to this cause. I think we are desperately lucky to have you, and most especially diabetics in West Virginia are lucky to have you advocating on their behalf. So take care of yourself, and I will share my screen again here just briefly so I can brag on my other friend here. There we go. I hope you can see that. Miss Joanna Vance is a Boone County born, Beckley based advocate and community organizer for economic justice. She is a survivor of generational substance use disorder, a wife, a mother, a peer recovery and narrative coach, and most recently, she is a candidate for the West Virginia House of Delegates in District 43. I hope that's correct, Joanna. Please correct me if I'm wrong. So she's gonna share a little bit about her story with you today, as well as her experience sort of climbing up that advocacy ladder and the experience now of running for the House of Delegates in a climate and in a situation, as I said before, where most people in the Capitol, most people who are serving us in the Senate and in the House here in West Virginia will never experience the need to access social support programs such as Medicaid, such as WIC, such as CHIP, which, as we know, are all vitally important to so many people across our state. So I'll stop yammering here, and without further ado, I'll introduce Miss Joanna Vance.
Sorry, I pushed a different button. Hello, everyone. My name is Joanna Vance, and today I want you to see me as a storyteller, but not just a storyteller, an effective storyteller. When I was 8 years old, my mom used to take me and my brother to this place called Dismal Falls. If you grew up in West Virginia, you know that we like to swim in the creek. But this just wasn't a creek, it was a swimming hole, and it had a waterfall that people jumped off of. But I was scared to jump off of the waterfall, and I looked down below, and there was a lady who I did not know. And she said, if you jump off, we'll do it together. If you jump off that waterfall, then I will dive into the water down here and I'll meet you. was like, okay, so I don't have to do it alone. So we counted 1, 2, 3, and I jumped and I plunged into the water. And when I came up, I was so excited that I did it, that I turned to see the lady that had encouraged me, to find her floating belly side down in the water. And I thought that she was playing as I swam over to her, and I saw a stream of blood in the water, and it was coming from her head. And I started screaming, help, help, but all of the grown-ups were too far away to hear. And I took all of my might and I pushed her over, and so that she could breathe. I'm still screaming, help, help, and I'm swimming with all of my might over to the edge of the water. And thankfully, by the time I got to the edge, there were grown-ups there to help pull her out. And then the ambulance came, and they said that had I not helped her, then she would be dead. She had fractured her spine in the shallowness of the water when she dove in. But from this, I learned at a very young age that more often than not, you have to be the help that you need. You have to reach down and be the person to help yourself, others, because if not, then who? But this is why I do the things that I do today. This is why I work in social economic justice development. This is why I do grassroots organizing. This is why I do strategic planning and implementation, because here we are out here every single day helping people, helping individuals, helping groups, trying to make the world a better place. And I know that you care about this stuff also. I know that you care about especially affordable health care, because you wouldn't be on this call today if you didn't. But now, today we're facing a problem. We've got the rise in overdose deaths is at an all-time high, suicide, mental health disorders, our jails are overcrowded, generational poverty, mental illnesses, transportation. I could go on and on the list forever. But we have these problems, and we're all out here doing grassroots organizing, on the ground work, screaming help. And we can't get the help from our legislators that we need. So we must get their attention. We have to work and share our stories and make them listen, because that's their job. That's what they're elected to do, is to help the people in their districts. Because if we don't, then West Virginia is going to continue to decline. People are going to continue to leave, continue to die, not get the health care that they need, that they so desperately need. But if we do, we can put a curve to generational poverty. We can get people the health care that they need. We can get people help with substance use and mental health disorders. Like, we can do community diversion programs. We can build the West Virginia that we all know and love that it can be. So join me today by learning how to share your story for purpose, by reaching out to your legislators, because we are the experts of our own lives, of our own communities, because we're out here and we know, and they are supposed to listen to us, because my story matters, your story matters, your voice matters, and they need to hear what you have to say. So that was just an example of storytelling. That's the storytelling version that I usually use, because it has an arc. It has an arc of story of self, story of us, story of now, and then a call to action, right? Because when you're storytelling, you don't just want to start the conversation without sharing something about yourself, because then you were like, who is this person? So you give information about yourself, and you can change that story. Like the story that I use of growing up, you can use whatever memory that you want that leads into whatever your call to action is going to be. So you take that story of self, and then you connect it to a story of us, making it broader so you can build on and bring more people in, because we have more power in numbers. But you want to bring the people in, so something that they can also connect to. the problems that we're facing and the things that's going on. And then you have to tell them, this is what we need to do. Call to action, right? This is what we need to do. And this is the most important part of closing out, I think, often, because like, if we don't, but if we do, gives people a visualization of the two worlds and what it is and what it could be. And then often more times than not, when I see storytelling, like it's a great story and it goes all the way through with so much hope. But then that hope just ends up fizzling out at the end because there's not a call to action. There's not hope in action. Okay. Like you can't just get all these people excited together around something and then not have a call to action moving forwards, because, that's what storytelling is about. It's about building, growing communities for purpose, change, because we're not alone. So I started my storytelling journey in 2019, and I started because I'm a person in long-term recovery. I have lived experience with substance use and mental health disorders. So it's like, I'll be a recovery advocate. Lord, what I did not know that all of that would entail. So I started going out to the Capitol, participating in Recovery Day, in Reentry Day, just, getting my feelers out the first year. And then by 2020, I had dove headfirst into advocacy and lobbying on the state level, because there was no one there doing it. For the basis of nonprofits can't lobby, people who work for nonprofits can only have so many advocacy hours. And there are not very many real people up there at our legislation talking about real people issues. And I knew that was needed. Like they have to, they are so disconnected. Like it is absolutely insane. So if you don't have people with lived experience that knows on the ground what's happening up there talking and sharing their stories and telling legislatures, the conversations that they have in those rooms is just awful. It's so bad. As far as affordable healthcare, Lord have mercy. I grew up in the system, so I had Medicaid, and then growing like now, we have private insurance, which is even worse because nobody ever tells you how to work or use or navigate private insurances, how expensive it is, and then plus deductibles and copays. I think there needs to be a class around that, certainly. But that's why I'm a huge advocate, and on my platform, affordable healthcare is right there on the top, because I'll share this with you guys. This past summer, my oldest son had some issues, and he had to take an extended stay in Highland. And I called and I got all of his stuff done over the phone, and they were ready to have him. I gave him the insurance and everything. And then the worst thing that anybody's ever told me around healthcare was the words, "We'll make sure this insurance is approved before you can come." And I was like, well, what if it's not approved? How am I going to get the help for my son that I'm supposed to get? Thankfully, it was approved, and we did get the help that we needed. But now I got the bill recently, and he was in there for 10 days, $2,300 a day, the bill says. It doesn't say what services, what they did, anything at all. I know he played basketball, he ate pizza, they regulated his meds, but I don't know, $2,300 a day for what? For what? Who can afford that? Rich people can afford that. Working class is struggling. And that's why I'm also a suicide attempt survivor. Do you know how difficult it was to find a therapist that would do a pay scale and then still not stigmatize me for being a person in recovery, thinking that it's all about relapse instead of mental health issues? Don't even add in the fact when you have multiple children, like all the copays for vision, dental, regular, just regular pediatrician stuff. And all of the things that I care about, like recovery, mental health, all of that, those are issues that are directly impacted because people don't have affordable health care, because they can't get the services that they need. Or if they can, then it's just like double billing their Medicaid or whatever, or we can't help you because you have private insurance and you can't pay. That's just so much stuff. Wow, I went off on a tangent there. I'm sorry. But like, I have seen how effective storytelling works. I've been doing this now I coach other people how to share their story for purpose. But I have firsthand got to see how effective storytelling is, especially with legislators. Like, yeah, you can build a huge crowd to take to the Capitol with you with storytelling, but especially legislatures, like in the hallways, testimonies in session in the committees, presentations during interims. These people are real people, even though they want to act like they're not. They have their lives, they have issues of their own that they just may or may not talk about. But when you build relationships with them, it doesn't matter, Republican or Democrat, right? They still have issues. Like, I know Republicans in the legislature right now that there's some of their family members, some of their wives are in recovery, some of them are in recovery, some of them have struggled with substance use, some of them grew up in poverty. They're just real people, and anybody can throw numbers at people, data at people, whatever. They see that stuff every day. The point of storytelling is so that they don't see those, they see those numbers as real people, like they are. So it builds connection, and it humanizes the issues that they should. I don't understand why they're not humanized anyways. Like, make it make sense, right? But and now I'm running for House of Delegates. It's not something that I necessarily wanted to do, but the incumbent was running unopposed, and he doesn't vote the way on issues that I would like for him to. So I was like, sure, I will run. And I'm running my campaign. I'm not a politician. I'm a grassroots organizer, and that's exactly how I'm running my campaign, is storytelling, building my community, door knocking, talking to people about their issues and what they care about. Like, people are sick and tired, like real West Virginians are sick and tired of the two-party system, Republican, Democrat. No, they have issues. Like, people need to understand that it's not a party issue, it's a people issue. And when we start talking about issues instead of parties, people align on so much more. I guess in closing, one of the questions that Mariah had asked Mindy was, how did you get over the them and us? Now, my first year and a half, I was intimidated, so intimidated. Like, I'm gonna say who, but one of the delegates made me cry. And they say that's imposter syndrome. I don't believe in imposter syndrome anymore. I think that that's something that they made up to make people feel inferior, like they don't deserve to be in places that they have busted their butts to get to. So I came in 2022. That was my goal. I was like, there's no such thing as imposter syndrome in 2022. Like, those people, the only reason that those elected officials are special is because we voted them in there to represent us, and they can be voted out if they're not representing us. And I really enjoy doing what I do. Storytelling in the community, organizing from a grassroots level to a state level, like talking to our legislators. I keep them on their toes. They know it. But it's one thing, like, there needs to be more people. Like, it can't just be Joanna Vance out there fighting or Mindy Slango out there fighting. They need to see everybody, because that's how we push for change or vote them out. I guess that's all I have. I hope I didn't go over time and ramble too much, but thanks for listening.
You could never go over on time, Joanna. Listening to you speak is inspiring, empowering, educational. I'm always so blessed to have you on any one of these calls because you really are such a fierce advocate. You and Mindy both, just having your spirit and your energy on these calls makes me want to be a better advocate, makes me want to work harder. And I think I can speak for everybody else on the call who's gotten to listen to you both to share your stories today, that I think we'll be leaving here with a renewed sense of responsibility to work on behalf of our fellow West Virginians. Because you're right, we are all people. We all deserve to live. We all deserve to live prosperously and have attention paid to the real circumstances, the real issues that we're facing every day here. I had a couple of questions from the chat that I wanted to just give voice to really quickly. Sorry, I'm bouncing back and forth between devices here. The first one, which I think Joanna spoke to a little bit, was how is storytelling important, not just for lawmakers, but for healthcare providers themselves? We talk about stigma a lot, particularly when it comes to healthcare issues like substance use and recovery, and diabetes as well can often come with baggage and stigma surrounding it. And so if either of you wanted to jump in and speak to the importance of our providers, our healthcare providers, social workers, et cetera, understanding the human impact of the programs that they facilitate, and how storytelling can help offer them perspective on that.
If it's okay, Mariah, I'm actually going to be speaking to next month to a group of providers, both for diabetes, both doctors, nurses, dietitians, educators. And so I'm going to be talking to them about the patient side of insulin and the insulin crisis in West Virginia. And it is important, I think, because they get into a rote. You know, they're seeing patients, they're dealing with what's in front of them. And they don't often understand, at least in the case of diabetes, I don't think sometimes, the issues of affordability and how people are struggling, because there is also, at least in my case, I certainly didn't go to my doctor unless I absolutely had to about affordability. When it became to the point of rationing, I did talk to him about it, and we tried to adjust as best we could, but there wasn't a whole lot we could do. But I think people have a sense of pride, particularly in West Virginia, and they don't want to admit that they're struggling. And, somebody told me that, I'll put some duct tape on it and move on. But, this isn't really something you can just duct tape and go back on the field. This is, you need access to your medication. So I'm going to talk to them about the importance of engaging with patients in the clinical setting about, how are you doing? Are you able to afford everything? What can we do to help? Because while it's not a permanent solution, there are some programs that can offer temporary relief. I'm actually going to be trying to introduce an emergency insulin bill. I'm going to work with some of our delegates and Senate leaders and try to get an emergency insulin bill passed in West Virginia, so that there's a stopgap measure, at least there, so that we have some emergency things to help cover those gaps. But I think it is really important for people in the healthcare industry to engage with their patients about affordability issues and what they're having. And, I know that they're overworked and already overburdened, but at least, try to make someone aware that, or at least give them some resources that they might not know that are available.
Yeah, absolutely. Thank you, Mindy, for that. And please let me know how that presentation goes. Like she said, it's so important, not just for our lawmakers to understand the human impact of these policies, but for providers to be in touch with their patients as whole, well-rounded individuals. You know, we're not just our diagnoses. We're not just our health file. We are the sum of our experiences, and that includes where we're at financially. I can't imagine what it would mean to me at several different points in my life, and being only 27, thankfully, I've not yet encountered a lot of really serious healthcare needs yet, but in the few situations I've been in where I've been in a doctor's office and I've been scared and insecure, and I've not felt empowered to advocate for myself, what it would have meant for me to have a doctor say, how are we going to get you to afford this? Let's make a plan together to make sure that you can not just get the medication you need, get the prescription, but maintain care, maintain yourself and your mental health and your finances as well, because it should never have to be an issue of, will I buy groceries this week, or will I buy my prescription? Will I get my insulin, or will I get my kid new shoes for school? So it's really important, I think, for providers to have that perspective as well, and to see us as whole, real individual human beings. And the last question I wanted to speak to that was in the chat, thank you, Brittany, for fielding that for me in writing, but somebody asked if I'm interested in sharing a story and I reach out, what are the specific steps that happen next? Do I need to write down my story? How do I do this in a way protecting my anonymity if I'm not yet ready to share my identity? And that's a really, really good question. I'm so glad that you asked. So as I said, there are many, many different methodologies for sharing your story. There's many ways that can take shape, and many ways that we can disseminate that experience and that information. And those ways don't have to include your full first and last name, your picture, and a video of you. So what your first step would be to, of course, to reach out to me. Let me share my screen once more so that you can have my contact info up here while I conclude my spiel. Let's see, there we go. So you would reach out to me either by phone or by email, shoot me a message on Facebook, any way you want to get a hold of me. And we'll talk about your experience, just a very casual one-on-one conversation. I will ask you about your healthcare experience and how you've found the affordability component. And we'll start to talk about what issue areas your experience is relevant to. We can share your story in written form, and that can either be through my transcription of an interview between the two of us, and I can jot down some thoughts and share back and forth with you. We can develop that narrative together. I can field you through the process of writing a letter to the editor of your local newspaper, or an op-ed article. You can write a blog post for us. You can remain completely anonymous, and we can just use your voice and a picture of something that has nothing to do with you. There's lots of different ways that you can share your experience and your story while also protecting your privacy. So it really is subject to the individual and what is right for you. But absolutely, the first step of the process would just be to get in contact with me. My number and my email are there on the screen for you if you want to get a hold of me. And we can share as much of your story or as little of your story as you like. You also can withdraw consent at any time. If you decide that you no longer want to have your story up on the website or on the Facebook page, we can take it down and put the toothpaste back in the tube a little bit, so to speak. But absolutely get in contact with me, and we'll discuss how we can get this done in a way that makes sense for you and for your family, in a way that gets you involved in this process of healthcare advocacy, and does so in a way that makes you feel empowered and positive about it. If there are no other questions for myself or for any of our wonderful speakers today, I will thank both of you so much again for taking the time out of your busy schedules, and for lending your experience and your time and your work towards these really important issues, and for the good of West Virginians. And I speak for myself, everybody on the West Virginians for Affordable Healthcare staff. And I'll be so bold as to say, is on behalf of the people of West Virginia, thank you for your advocacy work and for your tireless effort towards these causes. And I'll throw it finally to our Executive Director, Jesse Ice, I think, for our conclusion.
Yeah, I would like to say, obviously, thank you to Mindy and Joanna for sharing your story. I know it's not always easy to be that vulnerable and share that out loud. I would like to note that Mariah is excellent at sharing your story to the level of your comfort. So just because you don't want to be publicly visible doesn't mean that your story is not important and we can't use it to advance pro-West Virginia healthcare policy. So I really appreciate this session today. And I would like to point out that we have one more session of our Medicaid Summit coming up. It is tomorrow morning, and it will be focused on health equity and health disparities amongst different communities in West Virginia. So I would love if everyone could join us then. I would also like to say that we will make available these videos in the future, in the near future, so that people can look back on and share them. So, if you know anybody who would benefit from learning this material, feel free to share it as soon as we get them together, because I think we've got a very compelling narrative from this on why storytelling is so important to healthcare policy advocacy. So I appreciate you all attending, and I hope to see you all tomorrow morning at 9 a.m. Thank you.